You are welcome to another informative and educative episode of African Student Voice on AAU TV. My name is Ajaman Otredaku. I'm glad to come your way with another great episode. It's time to learn. African Student Voices, we learn, we transform, and we educate. And today, on this episode, we're going to show you more about COVID-19. Understanding the virus is very important. And we'll have good experts in the house to defy the odds. The odds on misinformation regarding the COVID-19 virus. Basically, many people have different variant thoughts about COVID-19 and are doing things basically out of what people are doing, but they don't have the understanding of the virus and how to prevent it. So I have great student experts here who are good in health to help you know what exactly it is that you have to do to keep yourself safe. Have the understanding. Don't go anywhere. Go for a short pause. We'll be right back. I'll let you know who my guests are and we'll zoom back to discussion. Don't go anywhere. Welcome back to African Student Voice. If you just joined us, we're discussing defying the odds on misinformation regarding COVID-19. And you can watch us live on Facebook and YouTube on our platform, the Association of African Universities, on Facebook and on YouTube. Bring in your comments. We'll be glad to see what you also have to say about this. Now, to my guest today, I have with me Madame Paulina, Yayra Kpogli, a midwife, and also Honorable Mariama Adama-Issah. Welcome for the National Health Association of Ghana and also the Youth MP for Wa East. Honorable, you're welcome. Yeah, you're welcome to African Student Voice. I'm so glad you made time for this very important session to educate and to inform our viewers all over the continent, all over the world as well, about COVID-19. We're trying to defy the odds here on misinformation regarding COVID-19. So I want to start with you, Yayra, on the nature of COVID-19, basically. What is the nature of COVID-19 globally and locally? This is because, many people think that COVID is actually massive overseas than it is in Africa. So we think that it is not really working here or it's not really causing that harm here. What do you have to tell us on this case, understanding the impact of COVID-19 globally and locally?
Okay. Actually, COVID-19 is from a family of viruses. Mm-hmm. Yes, from the coronavirus viruses. Mm-hmm. And those viruses usually affect the respiratory system, the respiratory system of the human. Mm-hmm. But it's most at times transmitted through animals. Mm-hmm. But now we've seen that it can now cross its border and affect human beings as well. Okay. And human beings can also transmit it from contact to contact. Human contacts can also transmit this virus. Actually, this virus started, we all know this virus started outside. Yes, not in Africa, in China. It came from China.
So it came from China.
China,
does it mean they caused it or something else?
No.
It came from China.
That is where the disease was first found.
Okay, good.
Yes, in China.
Good.
And as it went on, it's something new. They didn't know anything about it. Okay. It came as a pneumonia case. Okay. But they realized that people were dying out of it. Even the pneumonia drugs they were giving them weren't curing the disease. Okay. And they didn't even know how it's been transmitted. And because of that, because of the lack of information about this particular virus infection, more steady search went into it, and it has noticed that most of the times contact to contact, human contact can cause it. That's how come it got spread. Okay. People left China to other countries and they took the virus along with them. As in, they were infected before they left China. But because they didn't know what causes it, how the signs and symptoms are, because most people come with different signs and symptoms of this particular virus each day, and they don't know how to combat it at that time. So they couldn't keep this virus from spreading. And not only does it spread in the outside, let's say Africa or anything, it goes everywhere.
Everywhere.
So far as the person is infected and is in that country and has had contact with someone else without prevent or without going through or observing the protocols, that person will surely transfer that virus to someone else. So it is there. People are dying outside. It is in Africa. People are dying as well.
Great. So you know that now it is everywhere. People are dying in Europe and also in Africa as well. And it wasn't made in China. It came from China. It wasn't made in China. Please, let's get it out right. Mariama, what have you got to say about this? Give us more understanding about the COVID virus globally and locally in Ghana.
Oh, okay. Thank you very much.
Okay.
I think coronavirus, as the name goes, corona.
Sure.
It means a crown. So itself, it feels like it is a king.
King.
Okay. So it's coronavirus, crown virus.
I see.
Okay. And there are groups of viruses. This particular coronavirus is a respiratory virus. And what they do is they cause illness. They cause mild illnesses and also severe illnesses.
Sure.
It starts from the common cold we call like catarrh. And from catarrh, the severe ones are the Middle East Respiratory Syndrome, that is MERS, and also we have severe acute respiratory syndrome, that is the SARS. But for the severe acute respiratory syndrome, that one, there was an outbreak in 2003 previously. So that one has been recognized by the scientists that we have this strain and it is there.
I see.
Now another outbreak came. It started in China, Wuhan. That was December 2019. And after research and everything, the scientists came out that no, this strain is different from the previous SARS. So they are going to name this one SARS-2.
Okay.
So the COVID-19, that is COVID disease 2019. So this is a different strain from the previous one. So they have to start doing research about the strains and know what they can do, about it.
Sure.
This particular viruses, SARS, SARS-1 and SARS-2, they are the same, just that they have similar structures.
Okay.
And one thing about them is that on their surfaces, they have a protein on the surface, and that protein helps them to, aside that protein, they also have envelope. That envelope helps them to stick to any surface.
I see.
So when they stick to the surfaces, what we can do to them is to kill them with disinfectants.
I see.
That is why the preventive measures, we always say that we've been advocating on, clean your surfaces with disinfectants, because they are easily killed by disinfectant when they fall on surfaces. When they get to you, you can't take disinfectant. You get it. So you sanitize your hands and then you clean your surfaces. You are safe. Number two, when they get into your system, for the initial stage, your immune can do some, your immune cells can, respond to it and try to fight a little bit when they get to the nasopharynx, do something about it. But when they travel down into the lungs, this is where the damages will start. What they do is that they have a receptor. They have a protein on their surface, and they attach themselves to a specific receptor, which is ACE2 receptor. That's SARS-CoV-2 receptor.
Sure.
So when they attach themselves to that receptor is on the surface of your healthy cells in the lungs. So when they get there, you use your air sacs in breathing and exhaling. You get it?
Sure.
So they attack the wall of the air sacs, the lining of the air sacs. They damage this wall and the lining of the air sac. So when your immune cells realize that no, something is happening, and they try to defend it, then it becomes serious, and you realize that the lungs itself will be inflamed, and it will be filled with fluid.
I see.
When it's happening like that, it will be difficult for the swapping of carbon dioxide and then oxygen to take place. So the person will experience difficulty in breathing.
So that's why you hear them choking.
Very good.
Okay.
Do you get it? So what we are saying is that COVID-19, the COVID itself, that's a SARS-CoV-2, it is very, very, very dangerous. It goes into the body and then depletes the lining of the blood vessels. And the function of these blood vessels, this is where our blood passes through. and blood is life. So they deplete it and cause a blood clots. So the moment the clots start coming, what will happen? The person can't survive.
I see.
So this advocacy about COVID-19, you being in US, being in UK, being in wherever, globally, I think we have to look at the nature of the virus itself. When it gets you, what it can do to you. When it get me being black, what it can do to me in a while. We shouldn't think about, oh, someone is outside there, so that place there because of the cold, the person will not get it. No. We should look at what the virus can do when it gets to us, basically. And also adhere to the preventive measures we are practicing. Yeah.
Sure. So that is really clear about that. It doesn't matter where you may be in the world, either in Africa, Europe, or Asia. If you get COVID-19, it will deal with you like anybody else anywhere in the world. Now let's go deep into the main questions. The very first one, can COVID-19 be transmitted through the goods produced in countries that we have infections, like goods from China, goods from UK, goods from Spain and Portugal coming into Africa? Are these can they be infected by COVID-19 if we get into contact with these goods?
Actually, the COVID-19 virus can stay on surfaces for some hours.
Okay.
And sometimes for some days, depending on what kind of surface it's on.
Are we sure of these hours and days, if possible?
No.
Okay.
No, please.
Okay.
Yes. But when it comes to goods, you know that before goods get somewhere, most times it has to go through shipping, some have to go through the plane, and all this comes with temperature variance.
Yes.
Okay.
Yes.
So transporting, it would go through a lot of temperature differences before it gets to its destination.
Sure.
All that distracts the time with which the COVID virus can stay on the surface. So it can be transmitted through, it can be transmitted through
the goods.
No, COVID-19 virus can be transmitted through the goods.
So you mentioned that it could stay on the surface for some time.
Yes, please.
Hours or days.
Yes, please.
But you believe that the temperature variances can in one way or the other deplete the virus on its own?
Yes, please.
Before it gets to this destination?
Yes, that is what WHO says.
Okay.
And also, we know that because of the nature of this COVID-19, now they've put measures in place that before a good goes here, it has to go through its own. I'm sure and I know that most those people who do this sending off of goods, they also have their own set rules concerning this COVID-19. How are we going to transport these goods during this pandemic?
Yes.
Are we just sending it without knowing or without even knowing the person bringing it, if the person has the virus or not? All that counts. So I'm true that they have this, true that they have the chance to know, check temperature, ask them if they've had contact with someone who has the virus, or if they've been to a place whereby they've been exposed to the virus. All that helps in reducing the rate at which the virus can travel. And the goods to go through some precautionary things they do, such as a spraying of the goods with disinfectants.
Yes.
They have the spray, which they disinfect the goods before they send it.
Yeah.
And also the temperatures, as I said, as it's inside the plane or wherever, the ship, wherever, time changes. Some of the things they've not showed us the number of days the virus can stay on the surface. But as time goes on, it will surely deplete and die. Yes.
Mariama, let's come to you. You know, we are very worried that an infected person, if bitten by a mosquito, and the mosquito goes for somebody who is not infected, we are worried that maybe that mosquito will also aid in the spread of COVID-19. Tell us, is this possible? Is it true that mosquitoes can also transmit this COVID-19 to other people?
Please, it's not true.
It's not true?
No.
But it's the blood. I mean, if COVID works through the blood and the mosquito just spreads the whole thing, it's the same thing. Oh.
It's not true. The COVID virus can only be spread through a droplet from a cough or sneeze and a patient's saliva. These are how you can, get it. But for mosquito to bite you, no, it is not possible. It can't be.
All right, so mosquito is out of the case, okay? Let's.
Moreover, you have to know mosquito is a vector for Plasmodium species. So it doesn't even relate to its functions. COVID-19, no, it's not even part of its work at all.
As for me, I'm clearing the doubt. I'm clearing the doubt of people.
Okay, it's not true.
Okay, so let's go to Yayra. Can COVID-19 be spread through somebody who's infected clothes? Those who mostly use the public transport and also public vehicles, they see with many people. Somebody goes to the market, touches people, and their clothes. We claim, or we say we perceive that they may be bearing the virus. So if I sit close to that person in the public transport, then I have the virus with me. If I go home, I should remove my clothes and then start washing. What is the case here? Is it spread? Can we spread COVID through the clothes?
I would say that COVID-19 is, as she said, is spread through sneezing. It's a respiratory disease.
Yeah.
So sneezing, coughing, and it's a droplet. So when someone coughs without covering his or her nose or mouth, and then it falls on a surface, let's say in the church, in our local buses, where someone coughs and this virus falls on the seat.
Yeah.
Someone sits inside. As I said earlier, COVID-19 virus has its can survive on surfaces for some time. Yes, and that is why the government and other health bodies have come together to say that let's distance ourselves. Let's observe social distancing so that in case my clothes takes the virus, so far as I have it on my clothes, there's 1 meter distance between us. You can't be infected. And we are also advised, especially those who work in the hospital area, that anytime you wear your clothes, knowing that you will be exposed to this virus, as soon as you get home, you take it off and put it inside something you can and wash it. That shows that it can be transmitted. If you come closer to me and I have the virus on my dress and you touch my dress now, meaning you have the virus on your hands.
Yeah.
And if you don't wash your hands, what happens? You touch your face or you touch your nose. The virus now goes into your respiratory system and causes its own problems there. So it can be transmitted. But when we put in the precautionary measures, that is social distancing, let's make sure there's 1 meter distance between you and the person. Anytime you go out and you know very well that you've been exposed, you've met someone who has the virus, you've been exposed to someone who has the virus, then quickly take off your clothes as soon as you get home, put it in a disinfectant, and then wash it and dry it. That is the way the virus can be killed. Okay. Yes,
Mariama, we somewhere last year we were hearing things that, if you want to be safe from COVID-19, you apply alcohol on your hands, and then we had so many people thinking that you can drink this alcohol actually, because if the virus goes into you and works, then drink alcohol, it will burn everybody or every virus off you. So people are now buying so much of alcohol application just to kill this. What is your view on this one? Medically, is it appropriate to do this?
Okay, it is not appropriate. I don't go by it. It is not true. So we should clear that from our mindset. What I know is that, when you take in alcohol, as I said, it can kill the virus in you. When you take beer, you take liquor, this kind of alcohol, it cannot kill the virus in you. But the best thing you have to do is to adhere to the preventive measure, because even firstly, the alcohol you are taking also has its excessive intake of alcohol. It also has its, chronic problems it will be bringing to you.
Sure.
As you are taking it gradually from now, you won't see the effect. But as time goes on, you become addicted to it. Then you realize that, no, this same alcohol can give you liver problem, heart problem, hypertension, even the lining of your stomach, the small intestines, and the others, you'll be depleting the lining. You get it? The mucosal lining there, you'll be depleting it. So I think taking alcohol itself, we have to do. It's not about my religion, but wholly alcohol intake excessively is not good. And relating it to COVID-19, it doesn't match at all. Even though we use 70% isopropyl alcohol for disinfecting our hands and using it to prepare sanitizers, doesn't mean that alcohol is what we have to take. Remember, that one has been prepared in the laboratory in a different way altogether, which is specifically for disinfection. But it's not meant for you taking it as in to prevent something. It does nothing like that, And one thing I want to add is that, you see how alcohol is like? It contains some molecules, and that molecule, the moment it enters into you, I can't explain the medical terms about like how, I don't want to confuse, but when it gets into you, don't think the way you see it out as in it's killing virus. So it's going to kill. No. There are different things that happens within you. So we should stay away from it as in using it to prevent COVID. No. You can take it for your own pleasure, but as in for COVID prevention is never done. Let's stick to the preventive measures to be safe.
Great. So it's getting interesting right here. Questions have been answered, and we're seeing the medical viewpoints of all these odds, all of this misinformation we have out there. Don't go anywhere. We'll bring you more of this question and answer session with our experts on COVID-19 to this short break. Don't go anywhere. Welcome back to African Student Voices on AAU TV, and I'm glad you're with us on this topic, defying the odds on misinformation regarding COVID-19. And I want to take a short time to just read a couple of comments out there that we're seeing on the page. And I really want to say, we have this from Hamza Suleiman, says, Miss Mariam, my greetings to you, and you're doing an incredible job. Keep it up. Thank you very much, Hamza. And anyone out there who wants to bring in a comment or a question, please do well to bring it in. We're glad to read to you and also address your issue or doubt. Let's move on with this one. Is it true that COVID-19 is much transmitted in a cold climate compared to a warmer one? How is it? So we consider in Africa we are protected with our climate, and whilst we'll say back in Europe they are at a disadvantage with their climate. Is this really true?
No, it's not true. I remember when this COVID, when it came, and the information got to Ghana that there's this happening worldwide, and most people in those in the Europe or Asia countries are being affected. And we thought because we are in this, we have this hot climate.
Very hot, 34 degrees
very,
Celsius,
very hot. So we are not part of it. But as it stands now, Ghana is also having its own cases.
Yeah.
People are getting the virus every day, and people are dying from it every day. Others, to glory be to God, they are recovering from it too every day.
Sure.
So no matter where you are, if you are in a hot climate, cold climate, no matter where you are, you are prone to have the disease.
There's this very important one that I want to put across with the vaccine. I know that the vaccine is a very controversial issue as at now. But I want us to just speak a little bit on it from your point of view. Is it that dangerous to take a vaccine? Everyone. Mariama, is it that too dangerous to take a vaccine? Everyone.
Okay, let me start with the everyone you chipped in. Everyone, not for everyone. Because immunocompromised patient cannot take it. Ages lower, that is 18 years, I think below 16 can't also take it. Pregnant women, I think the research is still going on.
Okay.
65 and above, can still take it. So it's not everyone. And the whole concept about COVID-19 vaccine is perfect, 100%. It's very good. I'm saying it's very good in the sense that I said earlier, when the virus gets to you, it uses its protein on the surface to, attach to a receptor and then gets to your healthy cells and start damaging the healthy cells.
Yeah.
When you take this vaccine, it's a way of, preparing you for immunity. Okay, when we introduce the vaccine into you, your immune cells will be activated and then they will respond to it. When they get activated, they will produce antibodies against the strain they've introduced it to. Okay, they will produce antibodies against it. So anytime, that means there is a memory that anytime you get in contact with an infected person, the body has already, produced the antibody. So instead of it pulling you down as in you don't have that antibody, instead of you pulling the disease pulling you down, it will rather minimize its effect on you.
Okay.
You get it? And people are complaining about taking it and feeling feverish and that kind of small side effect. I want to clear this conscience that when you take it and you react to it, it shows clearly your immune cells have responded to the vaccine.
Okay.
Because anytime you take any vaccine, you're supposed to react slightly to it. You reacting means your immune cells have been activated and they will provide antibodies, against it. Because there is no, it's not any vaccination that gives immunity. Unless you will be assessed to see the vaccine you've taken has been triggered your immune cells to produce antibodies against it. So when you go for the vaccine and then there is a slightly reaction, don't say the vaccine is not good. No. It's rather showing you that your immune system is working and is providing antibodies against that.
I see.
So I think we should clear the mindset of it's not good, and go in for it. Because the content of the vaccine itself, getting into your system to help minimize the death and severe critical stages of the virus. I think when we take it during the initial stage of the infection, your immune fight against it and we get healed, because many people get exposure to these viruses every day, but because they have a stronger immune system, that they won't even get to the next stage, talking of the critical stage, and it will go off. So the main concept is they want us to take the vaccine. At least even if you get to the initial stage, you won't get to the critical. So your body can at least help you survive.
So is that a reason why after the vaccine we are supposed to still follow the protocols and not think that we are on top of everything? But we heard that after the vaccine, still wear your nose mask, still wash your hands, stay out of the point. People are just telling, if a vaccine is to strengthen you, is to give you that immunity, then why should you still go through the same protocols again? What kind of vaccine is this? So basically, you are saying that these vaccines actually prevent you from going to the critical situation, no, by the initial or other. So that's why we still need to do what we have to do, basically.
Yes, please.
All right. I know some people who are taking garlic. Garlic is their vaccine. And they are chewing garlic morning, afternoon, evening because they think that garlic has the components to also prevent you from going to the critical stage. What do you have to say to those people?
For garlic boosts the immune system. Okay. It's an antimicrobial, should I say, herb. It boosts the immune system, but it doesn't cure coronavirus. It only gives you, it only strengthens your immune system so that when you get the virus, you might not get to the critical stage of it, but it doesn't cure. So those who take the garlic each day thinking that it's curing it, no. It's not curing it at all. It's only boosting your immune system.
I see.
Yes.
Someone will say that these thermometer guns are used to check your thermometer, your temperature all the time. Sometimes you see the figure and you're like, are you serious here? Is this gun really effective sometimes and telling that who's really affected or something?
Thank you very much for that. I think much education should be done, because the disease itself starts you being asymptomatic. That means you are not showing the signs and the symptoms.
But you have the virus in you.
You have the virus. So you're showing thermometer gun on my forehead. Then you're checking my temperature. I don't see it as 100%. There are some instances the moment they check you and the temperature is
they'll show it to you.
Go, you are safe. It's a big lie. Because the virus takes 1 to 14 days to manifest. So what about if the person has been infected the first, the second day, and the thing there is no sign showing the person is asymptomatic? Well, how will you know the person has the virus? So the gold standard, I think, that is you doing the test, the COVID test, to prove that yes, the person has it. So then we have to be preventing ourselves. So we do the test. Though the thermometer gun, I don't think it's 100% qualified that you don't have. No. I don't buy that.
Okay, all right. So that's a good one. So I think we're getting to a point where we have to wrap up. Though time has given us quite room to explain ourselves, but we can't really take most of your time. So we'll be wrapping up at this point. And I want to put a very last question to you all to tell the viewers out there. Tell someone what they need to know about this. Some people are hoping that there'll be a drug. I want to ask you, is there any drug that can prevent or treat COVID-19?
No. There's no drug. A time came, they said quinine can cure COVID-19. But quinine is for malaria and other immunocompromised diseases. That's what quinine is used for. And when they tested it on other people, they realized that no, it's rather worsening the case. People are rather going into the critical stage of the disease. So there's no, at the moment, there's no drug. And our researchers are doing their best, and they've come out that vaccine is the only way to rule out this disease in the world. Vaccine is the only way. And right now, they've brought in vaccines. Ghana, I think in March, they received some vaccines. This month, we received some vaccines. We gave it out to people. Some people had side effects. Others too didn't react to, didn't have side effects to the drug. And it's a normal thing. So far as the side effect didn't escalate into something else, then you are okay. We are also waiting for the second dose. Scientists just said, we need a vaccine. And God being so good, a vaccine is out now. And that's all we are depending on.
All right, what do you want to add your remarks? Just speak to someone out there. What they should watch out for.
Oh, okay. It's talking of the drug for the COVID-19.
Yeah, and also what they should know about that.
Okay, I will say that if there is a drug for COVID-19, I don't think we will spend money going in for vaccine and other things and be covering our nose. And malaria has its medication, and I think people can intentionally even sleep in mosquitoes for it to bite them because they know they will go.
Yes, there's something somewhere.
Yeah, because they don't know much about recurrent infection, what it is, but because they know there is a medication, they go in for it. So if they give you medications that's alongside your immune also helps it to at least save you from it, that doesn't mean there is a treatment for it. But I think the best is it has come to stay with us till it vanishes. Ebola came and it went by itself. So till it vanishes, we still have to, take the vaccine, the first dose, the second dose to be fully at least protected, and also cover our nose, wash our hands, and then we distance ourselves. This is, I think, what we can also do to help ourselves.
Sure.
And let me add something here. Everything on this virus is, I think, based on scientists. Because globally, when you read you realize scientists did this, scientists did that. We have scientists in Ghana, but I think I don't see anything in reusing our scientists to, bring up something. Talking of, I know scientists, medical laboratory scientists. Now they've advanced. They are doing doctorate. And the doctorate they are doing is not a PhD. They've advanced themselves for 4 years to 6 years. So when they come out, they are professional doctors.
Yes.
During the vetting, I heard the vetting chairman asking of that particular rank saying it's PhD. They shouldn't confuse the general public is professional doctorate. I was disappointed because I was expecting something like, no, they are part of the medical aspects. When you go to the laboratory, I think majority of the work, I can say the sensitive part lies on them. Do you get it? So if they are now upgrading themselves to be part of the physicians, then they go around Once they go and there are some mistakes somewhere, even the sample they will bring to the laboratory, most of the time will be put in wrong tubes. Sample that you're supposed to eat before they take, maybe they will take it wrongly. So if these doctors are part of the physicians going around, after seeing the science and everything, they will take the sample here, do it this way, let's go to the laboratory, do the research and everything. I think it will help us.
Okay.
So we should take those people very serious. They are scientists. They do virology, microbiology, bacteria. They do all these things we are talking about.
Exactly.
Are done in the lab.
Exactly.
Research and everything is done in the laboratory.
Exactly.
When you go to Noguchi, there are scientists over there. They don't consider they are scientists. They do research and know what is going on. The strain is it. They extract DNA, RNA, and they try to make sure the nucleotide, what is it, the process and everything. These are work done by scientists.
Okay.
So what show that we can't also at least give ear to our scientists? We disregard them. Let's bring them into the light and also help them to, help us, take them across board for trainings and other things so that they can also come to help us with the knowledge, and we leave them in the laboratory rooms, disregarding them as if they... But let me tell you this thing. Let me just take 1 minute of your time and tell you this thing. This is something serious about... This is something that we all supposed to know about medical laboratory science. I'm a National Women's Commissioner. I'm not talking for any part because when it comes to medical students, I'm the National WCOM.
Exactly.
Laboratory student, nursing and midwifery and everything.
Exactly.
I'm not talking for anyone. But
Sure.
I feel like some people are being disregarded here.
Okay.
So I have to also talk, for them.
Sufi.
Imagine you have an infection in your blood. You go and see the physician. The physician will look at you. Write something. Go to the laboratory and do this test. The laboratory will then take your blood sample. They will culture the blood on a media. They will put the culture in an incubator, culture the blood so that whatever bacteria in your system will grow on the media. Then do you know what they do from there? They take, they isolate the growth, the bacteria, and then identify the type of bacteria that is giving you that problem.
Okay.
After identification, you don't end there. They have to look for antibiotics. They apply different antibiotics on that particular organism and see the one that can kill it.
Okay.
After that, they will write that antibiotic that killed the organism to the medical doctor. Then the physician will look on it and write it for you.
Okay.
So imagine if that scientist wrote a wrong medication, give it to you. You will be prescribed with what? A wrong medication.
That is suicide right there.
Do you get it? When you go to the laboratory and you do some investigations, and because they are being discarded as if they are not part of the health, this thing, they also do the work anyhow and give you wrong whatever. That is why many in our public, a facility, health facility, you see the death rate there always, goes up because the work has been entitled to one particular point. This person is this, and that is that.
Have you done a study? Have you done a study to check that all the mobility rates in these facilities are because of the disregard for lab scientists?
I have done that.
I think you should make it public, all right? Let's make it public then.
I have done that, and that is why I'm saying our laboratories in the facilities should be, at least they have to take good care of the laboratory. The doctors coming out from medical laboratory, those coming to be allowed to go to the wards and see there are some symptoms that are even, you realize that, this is it and that is it. They have much knowledge about it. There is a guy whose father was sent to one of the public facility. And the physician wrote D-dimer. The nurse took the sample into UDTA tube. Moreover, UDTA tube is not used for D-dimer tests. And they send it to the laboratory. The laboratory told her, it is wrong, go back and use this tube. She didn't mind them. So the son of the man came to the hospital. He is a scientist. I was like, where is my father's result? They said, they've not bring it again. He went to the laboratory and realized, no, it was brought in by a wrong tube. So the guy has to come back and ask the physician, why? Why should this happen? And it became a whole lot of confusion, between them. So imagine if this guy wasn't a scientist to know this is the problem or whatever.
Terrible. Terrible.
Do you get it?
I think I get your point now. I think we should find time to discuss the mishaps in the health facility.
Now they are fighting for their council.
Okay.
Okay, they are fighting for. I think they have to give them the
voice, right? I think we'll talk about this later on.
Yeah.
So I mean, thank you very much for the time you spent with us. Thank you so much, Madam Yayra, and also Mariama, for the time you spent with us, for the education and define the odds of misinformation regarding COVID-19. I believe you had a nice time. You got educated, you got the information you did, and now your understanding about COVID-19 is better. So do well to just let someone hear it, share the information, and bring your comments if you have any. Now, in these times, we can't have a conversation without COVID-19. It is part of us now, so we should be very cautious about it. Have a nice day and be careful. Have a nice day. Bye.
Yeah,